The process of drug discovery begins with preclinical work, and that is typically some of the most expensive and time-consuming aspect of the drug discovery process. This new system from PerkinElmer will allow us to increase the rate of getting to those preclinical lead therapeutics that have the potential to translate for clinical use. This new instrumentation will not only make high-throughput screening more efficient, but it'll also make the job of the scientist more efficient.
We used to spend lots of time not only designing the experiment, but also conducting the experiment by hand. And as a result, we work really hard, but the efficiency is not as much as we would like to achieve. So now with the new robotic system, we can spend more time communicating with our collaborators, center users about their needs, and spend more time in designing the experiment, and just use the robot's help to conduct the experiment.
The new equipment is fully enclosed and HEPA filtered, which means inside where all the equipment is arranged is sterile conditions, which is ideal for doing drug discovery of human disease models. And the robotic arm is able to travel up and down a track system, which gives it a lot of flexibility and movement.
I am impressed with the speed of the instrument and how many little things that we don't think about as when we're doing it manually. Delays, steps, being able to send something to the centrifuge, have it spin, or be able to send something to the dispenser. And we have 2 dispensers. We have a bulk dispensing that does it in one go, and then we have a more precise type of dispensing that will dispense small volumes so that we can do very precise experiments.
One of our new instruments, the Phoenix Plus, has 4 specialized cameras that allows us to image fluorescent light simultaneously up to 4 different fluorescent light channels. That makes screening much more efficient and facilitates drug discovery.
Students, researchers, we all do a good job and work really hard, but we're only human. We have our limitations. We just cannot work 24/7, but the robot can. Now with the robot's help, that we can definitely be able to handle more projects all at once and then get more results in a shorter time frame. And that makes our collaborators happy and make the center users happy. And we're hoping to be able to handle more business.
This technology has impacted me a lot because in essence, something I could do traditionally in 6 months, I can technically do it in 2 weeks or a month at the most.
This capability puts the University of Colorado at the top of drug discovery in this area, and we hope that the facility will allow us to expand drug discovery and to translate novel therapies for clinical use to help patients.